Hello and welcome everyone. Today our topic of discussion is anti-nuclear antibody testing. It is called A.N.A testing and our method is indirect immunofluorescence. In this video we are going to discuss about what are autoimmune diseases, how to detect autoimmune diseases, and what is the procedure of indirect immunofluorescence and its interpretation. Let's begin. Antinuclear antibody is a defining feature of autoimmune connective tissue disease. In autoimmune disorder, antibodies or cells produced by the body attack body's own tissues. It is caused by dysfunction of immune system of the body. Connective tissue is a structural tissue that gives us strength to joints, tendons, ligaments and blood vessels. Some of the examples of autoimmune disorders includes Sjogren syndrome, systemic lupus erythematosus, systemic sclerosis, rheumatoid arthritis, mixed connective tissue disease. Symptoms. Symptoms are non-specific and may affect different parts of the body. Body parts that may be affected include bones, joints, skin and mucosal surface lesions, heart and blood vessels, and lungs. And some of the diseases can cause serious pulmonary involvement. A.N.As are the class of antibodies that bind to the cellular component in the nucleus, including protein, DNA, RNA, and nucleic acid protein complexes. Two types of antinuclear antibodies are there. First is antibodies to DNA and histones. They include anti-dsDNA antibody and anti-histone antibody. The second is antibodies to nuclear material like anti-Smith antibody, anti-SSA, anti-SSB, anti-U3RNP, anti-centromere, SCL70 and Jo1. The classification of A.N.A is nowadays misused as their targets can be localized outside of the nuclear compartment also, like cytoplasmic membrane or extracellular, even if the term is A.N.A still currently used in the clinic. Indirect immunofluorescence test using the human epithelial cells and the primate liver is a gold standard for detection of antinuclear antibodies. Each bound autoantibodies produce typical fluorescence pattern depending upon the location of autoantigen. Let's see the short video of the procedure.
Overall goal of following test is to use an indirect immunofluorescent assay to screen for antinuclear antibody. This is achieved by incubating patient's serum into Hep2 substrate slide. The unbound patient serum is washed off. The bound antibodies are then incubated with specific fluorescent labeled conjugate and unbound reagent is washed off. When viewed through a fluorescent microscope, autoantibody positive samples will exhibit an apple green fluorescence corresponding to areas of cell or nuclei where autoantibodies are bound in pattern of fluorescence indicative of antigen being present. Ultimately, the pattern of A.N.A can be used to aid in diagnosis of connective tissue diseases.
So in this video we have seen how to perform indirect immunofluorescence assay for A.N.A screening. Now let's focus on the interpretative part. Autoantibody binding with nuclear antigen results in the 5 major patterns. They are homogeneous, speckled, centromere, nucleolar and nuclear dots. First is homogeneous. Antibodies involved are anti-dsDNA and antihistones. The part of the nucleus is involved is chromosome. And associated diseases are SLE, drug-induced SLE and rheumatoid arthritis. To identify homogeneous pattern as shown here, look at the mitotic cells or dividing cells. The mitotic cells shows solid uniform fluorescence. Resting cell nuclei should be uniform with diffuse staining. Second is a speckled, which is a coarse speckled. Antibodies involved are HNRNP, U1RNP and anti-SM antibodies. The part of the nucleus involved is a nucleoplasmic RNA protein complexes. Associated diseases are SLE and mixed connective tissue diseases. In The speckled pattern chromosomal region of mitotic cell does not stain with the fluorescence, and the resting cells shows speckled pattern throughout the nuclei. The speckling can be defined as a coarse or the fine. We have seen here coarse speckling. Now this is a fine speckled pattern. Antibodies involved are anti-SSA, anti-SSB. Part of the nucleus is small nucleoplasmic RNA complex. Associated diseases are Sjogren and SLE. This is a bright, fine speckled pattern with variable intensities, and mitosis will be negative in this pattern. Antibodies associated are pCNA. Part of the nucleus involved is toroidal shape protein encircles the DNA. Associated diseases are SLE. This pattern called centromere pattern. Antibodies involved are CNP A and B. Part of the nucleus involved is centromere. Associated diseases are systemic sclerosis. To identify centromere pattern, find out the mitotic cell. Dividing cells have numerous discrete speckled patterns with one another, also known as a metaphase bar. Resting cells shows 40 to 60 discrete speckles distributed throughout the nuclei. Now this is the nucleolar pattern, and it is a homogeneous nucleolar with fine granular nuclear pattern. Antibodies are SCL70, specifically topoisomerase 1. Part of the nucleus involved is nucleolar protein. Associated diseases are systemic sclerosis. The next pattern is a speckled nucleolar and coronary perichromosomal fluorescence in the mitotic cells. Antibodies SCL70, specifically U3-RNP and fibrillarin. Part of the nucleus involved is a small nucleolar RNP with protein complex. Associated diseases is systemic sclerosis. The next is a granular nucleolar and the smooth outside of the chromosome in a mitotic cell. Antibodies involved are SCL70, especially RNA polymerase 1. Part of the nucleus is nucleolar protein, and associated diseases are systemic sclerosis. This is the nucleolar with fine speckled pattern. Antibodies involved are PMSCL. Part of the nucleus is nucleolar and nucleoplasmic protein complexes. Associated diseases is systemic sclerosis. This pattern is called homogeneous with rim accentuated. Antibodies involved are nuclear membrane. Part of the nucleus involved is nuclear membrane. Associated diseases are primary biliary cholangitis. This pattern is centriole staining. Antibodies involved are centrosome. Part of the cytoplasm is pericentrin. Associated diseases are progressive systemic sclerosis or Raynaud syndrome. Pattern is smooth to fine speckled of cytoplasm. Now we are learning the cytoplasmic patterns of A.N.A. Antibodies involved are ribosomal P. Part of cytoplasm is cytoplasmic protein complexes. Associated diseases are SLE. This pattern is fine speckled to homogeneous cytoplasmic. Antibodies are Jo1. Part of the cytoplasm is tRNA protein. Associated diseases polymyositis and others. Pattern coarse speckled cytoplasmic. Antibodies involved are mitochondrial antibodies. Part of the cytoplasm involved is mitochondria. Associated diseases are primary biliary cholangitis. This is the reticular granular structure attached to the nucleus. Antibodies Involved are antibodies against Golgi apparatus. The part of the cytoplasm involved is Golgi apparatus. Associated diseases are SLE, Sjogren, and rheumatoid arthritis. This is in short about indirect immunofluorescence pattern in A.N.A profile. Hope you like it. Thank you and see you in the next video. Bye.